Hi, everybody. April here with Cannabis Care Team. 2 weeks ago, I shared a video on how to talk to your family members about cannabis, and this week I want to share a video on how to talk to your doctor about cannabis. I'm going to go over some really good resources for patients and just share a few tips. So, my favorite 3 resources you can find online, and a couple of them are specific to cannabis, and one is just in general how to talk to your doctor. Uh, this is a guide for older people talking with your doctor, published by the National Institute of Aging. However, I think anybody with chronic health conditions or anybody who's on a lot of medications can benefit from using this packet. So you can order this online. There's a lot of really good information in here, and there's a lot of really good resources in here as well. The 2 specific to cannabis I want to share with patients, and the reason why I talk about these resources is because I think it's so important that patients do their homework before an appointment with their doctor. You want to make sure that you have resources to give to the physician. You want to make sure that you have all of your concerns written down beforehand. I always tell patients, regardless if they're talking to their doctor about cannabis or not, you have to write those questions down or put them in your phone and make sure the physician answers all of them while you've got them in the room. When it comes specifically to cannabis, what else you want to do is you want to provide the physician with some information on why you want to consider cannabis, what effects you're looking for, what symptoms you're trying to treat. And I think that just gives the physician a better picture of why you would like to try it. So the Healer website is amazing, and so many wonderful resources are there. But they have this really good one that I give to a lot of patients to take to their physician and give to their physician. So healer.com has this medical cannabis healthcare provider info handout. And I really like it because it's directed to the physician. So it goes over therapeutic potential, the entourage effect, potential drug interactions. And what's really nice is that they have listed some of the really important studies on cannabis for medical use. So if your physician is wanting to do research on their own, they've got a list of some really good studies that show the medical benefits of cannabis. Americans for Safe Access is a nonprofit that can be reached at safeaccessnow.org. And they have not only this one, the talking to your doctor about cannabis, which I'll go over a lot of the same tips they share in here, but they have also condition-specific handouts. So arthritis is a really good one, and they just go over, I think there's 9 different conditions that they go into pretty detail, a lot of detail about those conditions and how cannabis works for those. So 3 good resources you definitely want to check out. When it comes to talking to your doctor about cannabis, there's really 2 schools of thought, and one is to keep quiet and don't say anything, and the other one is to try and have an open relationship with your physician about everything you're taking. Being a healthcare professional, of course, I want my patients to have an open relationship with their physicians. I think it's important for physicians to know all of the medicines and supplements patients are taking. And therefore, they're going to experience better outcomes. If your physician only has part of the picture, it really doesn't promote good healthcare at all. And physicians don't like to be in the dark on certain things. So try to have that open communication with them. Again, doing that homework beforehand, having resources to give to the physician always help. If you are finding that you have a physician who is supportive, a lot of physicians, they want to know how patients are doing with cannabis. They're curious, so they'll ask them for updates. And those are great physicians to have. However, those physicians most times can't write the physician recommendation for cannabis that you need to give to the state to get your license. So they may have a resource for cannabis physicians where you can get that done. Of course, there's tons of resources online for those. So Ideally you want to have a physician who is aware. Now, if you have a physician who does not agree with cannabis use or is refusing to provide treatment to you because of cannabis use, I got a couple resources that I want to share with you when it comes to that. A lot of pain management clinics and pain management doctors are under the impression that it's not safe to have a patient consuming THC and opiates. Now, the research indicates that opiates and cannabis work synergistically together, and cannabis has really helped a lot of patients get off opiates and has helped patients deal with the withdrawal symptoms. The CDC put out a letter, I think in 2018, directed to physicians prescribing pain medications, and they said that they should not be testing their patients for THC because of those reasons. However, you will still find a lot of physicians, especially in the Midwest, who are still testing their patients and will refuse to write opioid prescriptions if they test positive for THC. So, what you can do if you have a doctor like that, and most of my patients who are going to physicians to get pain medications, their ultimate goal is to get off those pain medications, and cannabis is just the tool to help them reach that goal. So, you could go to the Society for Cannabis Clinicians, and I think it's you type in your zip code, and you will be provided with a list of local physicians who understand cannabis as medicine. I have patients call the pain management clinic beforehand and ask them how the doctor feels about medical cannabis. Based on their response, it's going to give you a lot of information on if they're going to support that. And then there's a lot of support groups online and on Facebook. So I've done this before in a state I wasn't too familiar with. I posted the question, what pain management doctors are also seeing patients who consume cannabis, and they're aware of that and supportive of that. So I've gotten a ton of responses and names that way. So I think it's important that, again, if you can't have an open relationship with a physician, then you need to find one that you can have an open relationship with, of course, in the ideal world. And I think as we progress in the Midwest, we'll start to see more of that. So I think I covered a lot. Some really good resources. Have your list of questions and concerns written out for the doctor. Give them the science to show them why cannabis may work for you. They just don't have a lot of time, and because of the stigma attached to cannabis, they just haven't done a lot of that research on their own. So research is really important for them. If you have questions about where to get these, please reach out. You can email me at nurse@cannabiscareteam.com. If you want to talk to a nurse, or if you want to talk to us about our other services, you can always call 1-888-810-WELL. Our website, of course, is cannabiscareteam.com. The more people who subscribe to this channel, the more people who get to see it. Because we have cannabis in our name, we have to restrict users, and YouTube kind of blocks us. So if you can subscribe, more people will see us, and that would be wonderful, because we really want to help as many people as we can. And I think that's it. So if you have questions about how to talk to your doctor specifically, or if you have questions about things that your doctor has said specifically to you, please don't hesitate to reach out for information specifically regarding that. I'd be happy to help. All right, thanks for watching, and I hope you guys enjoyed this video. Bye-bye.